In this video, we'll finish going through these last couple of tabs on this top section. So again, we've selected a patient in this blue box, and then in the yellow box, we picked an appointment or a visit that we want to associate this information with. And then in the green box, that's going to tell you who this patient's primary care provider team is. So this is obviously important because it tells you who their provider is, but it also tell you who the clinical pharmacist is, who probably usually sees this patient. So that'll be a good person to reach out to if you have questions about this patient. And then in this box that has the magnifying glass, this will tell you again different demographic information about the patient. So we'll be able to have their date of birth, their address, and probably most importantly, their phone number if we need to reach out to them for patient counseling or just different questions we may have for them. In the postings box, we'll find the patient's allergies, and so it'll list the allergy and then what reaction they had to that medication, as well as different warning notes, crisis notes, things like that that have been added to the patient's healthcare record over time. If we click this Pharm Ed button, this is where you'll come to document patient education that you do. And so again, this box will not highlight unless we've associated ourselves with an appointment or added ourselves to an appointment. So make sure that you update this yellow box before you try to document your patient education. We'll click on this box and then it'll say, do you want to amend medication counseling for the current visit? And we say yes. And then it'll come up with this screen where we can go through and document the patient counseling. So we can typically click this M, or medication information box, and add in the comments a little bit about what the patient was counseled on. So a lot of times you can list the medication. So we'll say amoxicillin, and then you can put things such as indication, direction, and side effects as things you discussed. You don't have a lot of room in this section, so you want to summarize the information that was discussed. If the medication was dispensed to someone other than the patient, so for example, a child whose parents picked up the medication for them, you can click this dispense to proxy tab and you can put mother or whoever picked up the medication for the patient. There's other tabs that are more specific. So literature, if you provide the patient with, educational documents, things like a meter dose inhaler, if you show the patient how to use the device, and different things like that. So then when you're done with that part, you'll come down and click OK, and it'll save that information into the health record. Then on this point of care lab entry tab, if you click that, it'll come up and allow you a place to document things like a point of care blood glucose or A1C or a point of care INR. And then this tab as a student is not something you'll frequently use. So we'll skip past that for right now. And then in another video, we'll go through this tab here, but when this tab's highlighted, it means that you have something to sign off on in the health record.